Please welcome to the stage Ciappio and Lauren Eisen of Balchem for our final presentation of the day. They will highlight cutting-edge innovations in prenatal nutrition, focusing on research-backed ingredients like iron, choline, and folate that support the health of future generations.
Hi, I'm Lauren Eisen.
And I'm Ciappio.
And we're with Balchem. So we're going to talk to you, of course, about how prenatal nutrition supports innovation. So most of you know who we are at Balchem, but our vision is clear. We're here to make the world a healthier place. And by speaking today about prenatal nutrition, we want to make sure that we're speaking to a critical time of life and making a way that has an impact on generations to come. Our vision, as we just said, what we're going to do is talk about some market opportunities first, and then we're going to go into a few of the ingredients that we just spoke to. So on the screen here, you can see, as we all have attended some of the latest conferences this year and have been looking at the ingredient trends in the marketplace, the first thing we wanted to talk about is women's health. Going into 2024, what are the consumer trends? This has been top of mind, especially this year as we've been discussing post-pandemic. Fertility, prenatal care is certainly driving demand. The supplement growth market is reaching $64 billion. It's growing at 4.4% at the end of 2023. And as you look at the chart, you can see pre and postnatal sales are growing with it. We know that the volume might be stagnant, but when we look at the sales, we know this is coming from a premium space. And this is driven mostly among the way from innovation. And we're going to go through this in a little bit. But even though the birth rates are declining, there's certainly an opportunity when it comes to the growth rates that we're seeing across the industry. So what does this look like from a global perspective? What I showed on the other chart is the trends that we're seeing in the US. We can certainly see this on a global scale. So you can see this is an example from Japan. We can see tremendous growth rates. The birth rates are declining at a 25% across the years. But we're also seeing in a different light that organic baby food retail is declining at a rapid rate at 19%. This gives us an opportunity to see that retail sales are really driving value. So there's an opportunity right now in the premium space. So as sales are increasing, even though we see a decline in the birth rate, we know that women are spending what they can for their babies. They're spending or taking time, I should say, even though that it's a critical time in life, they want to make sure that they can do what's best for their baby. So this is an area that certainly isn't going to change, right? So when we take in a specific example, how can I show that to you in real time? So in the dark blue, you can see what are premium sales as a standard multivitamin. And you can see maybe flatline across. Their sales are doing pretty standard, although I should say, yeah, across the board, this is from 2020 through 2024. And an example we have here, taking a look at choline, that's the top across the blue. And that's one of our ingredients that we're going to talk to you about today. And you can see just through an innovation aspect of adding directly with choline, there's a significant jump from 2019 through 2021 from 7 million up to 33 million just with that addition of choline. So that's an example of adding a nice innovation of just a simple ingredient. And then you can see we're nearing up to 40 million just by adding that innovation, just by having sales. So as innovation continues, having an opportunity for something like a choline chloride capsule is really driving premium in the market. As you can see, there's an opportunity right now for innovation, hitting the significant dollar growth that our customers are looking for. So what is that choline chloride capsule innovation really look like? Here's a model case we can show you. Everyone knows Ritual, right? Those are, here's an example that right on the screen. So mom to baby support. Having a sidecar, this is this very simple example. It doesn't have to be complicated when we talk about innovation. And you can see from the screen or the graph, sales have gone up tremendously from the launch from January of 2024. So having a simple sidecar addition is certainly an innovation that proves high profit product and is a way to give mom that premium feel that she's looking for, improve cognitive function in products that she's missing from maybe a standard multivitamin. And so what we're going to do is talk to you about more of these ways that you can innovate through products that aren't so complicated, but really prove through science-backed in other areas. And so what does that mean with innovation? Innovation means differentiation through these premium products. We just spoke to how premium products means driving sales, and it doesn't have to be so complex. What does that mean that our consumers were looking for? I sat in the Wellcomes discussion this morning, and we saw what all those ways consumers from different companies are driving towards. Efficacy and science credibility are two ways we know that our consumers are looking when they're selecting wellness products. Those top factors that we know from our research is that effective and what works for me and high quality ingredients. Science-backed is something that certainly came up this morning, but really when we look at that, it has to be something that addresses my specific needs. And we're going to continue in today's presentation on what that means for us at Balchem, on what science-backed really means for true quality ingredients. On the right side of the screen, you'll see what are women really spending on. So when we look at 2024 and what is women's trends means, we can actually prove here that women are spending money, of course, on menopause products, a key trend of 2024, but also that pregnancy and prenatal, of course, are top products that they're spending on for this critical time of life, as they aren't going to sacrifice nutrition when it comes to making sure they have the right time for their baby. We also know that this is where they're going to spend to make sure that it's part of their routine every day. So before we get into the science, how do we address high-value consumers to grow your business as our customers? Overall, increasing the awareness of women's health. Birth rates are down, but we know that there's an opportunity in the category, especially when it comes to innovative products, to increase those sales. Investing in formulations to stand out as premium products, such as those choline capsules. Premium options are the way to go. Innovation can take many forms. That doesn't have to be so complex. In the new space, we mean better ingredients, new forms, new claims, sidecars, as we mentioned. And prenatals are just the entry point for our customers. So we know that consumers might start in the prenatals. This is the first time that after their 20s or early 30s that they've started maybe taking a vitamin every day. And this is where they're going to continue. So that if they're brand loyal, now they might be taking it over and over again and be loyal to your brand. So women are committed to nutrition at this point, and they want to do what's best for their family. So with that, as an introduction to the prenatal space, I want to hand it over to Eric to talk about the ingredients that help support these premium products.
Thank you, Ms. Lauren. So I'm here to tell you about some of these different options that we have available to you, and we're going to talk about three specifically. First up is our Ferrochel product. So what is Ferrochel and why do we care about it within the prenatal context? So I think if you've been in nutrition for any amount of time, you have heard the factoid that the most prevalent nutrient deficiency in the world is that of iron, right? And for pregnant women specifically, this is especially challenging because your needs as a woman are automatically 50% higher than it is compared to a man. And during pregnancy, it goes up by yet another 50%. So unless you are a hardcore steak eater, that is really challenging to get, right? Which is why, according to the dietary guidelines, iron deficiency impacts about 1 in 10 women who are pregnant in the United States, and in the third trimester, up to 1 in 4. And actually, according to AJCN data that was just released, 2 weeks ago or so, that number could be as high as 80% of women in the third trimester, so staggeringly high. Part of the problem is, of course, dietary supplements are available, as we all know. However, part of the challenge is with traditional iron salts like ferrous sulfate, for example, they can have undesirable effects, particularly GI-related side effects. One meta-analysis shows that the risk of GI side effects goes up by over 3-fold when using ferrous sulfate during pregnancy, right? So obviously, high GI problems is going to lead to a lack of compliance, and a lack of compliance leads to a lack of use of the product, which is bad from both a public health and a commercial point of view. If only there was a solution to that, right? Enter Ferrochel. So Ferrochel is part of our Albion Minerals portfolio. Albion, which had its start right here in Utah. The lab is actually somewhere in this mountain here. I'll give you $1 if you can find it. I know, it's terrible. But the advantage to Ferrochel is that it is what is called a chelated mineral, meaning that that iron at its center is bound by 2 molecules of glycine. And the advantage of that as that provides protection both from, limits the interaction of both the iron with its external environment and the external environment from interacting with that iron. So that results in two main benefits. Number one is reduced interference from things like phytates and found in food and other anti-nutrients, which increases the absorption of that iron. And second, it decreases the interaction with you, right? Which means that there's less GI upset available to that comes consequently with supplementation. So to prove that, I'm actually going to show you a comparison between ferrous bisglycinate and competitive products. And I'm not just going to show you a single randomized controlled trial. I'm going to show you a systematic review and meta-analysis of 9 total trials with over 1,100 pregnant women comparing both the efficacy in terms of raising hemoglobin levels as well as the presence of GI adverse events, comparing ferrous bisglycinate to other iron salts, which is a bit of a laundry list, ferrous fumarate, ferrous sulfate, et cetera. And what did they find? Lo and behold, they saw that there was a significantly higher efficacy of ferrous bisglycinate in terms of raising hemoglobin status compared to other iron salts, but also a 64% lower risk of GI adverse events from the use of ferrous bisglycinate compared to other iron salts. So significantly greater efficacy without the challenging GI adverse events that can come with iron supplementation. Shifting gears, we're going to talk about choline. So the first question that I often get with choline is, what the heck is choline? I think hopefully in this room, all of you know, but if you don't, a quick primer is that choline is an essential nutrient like vitamin C or vitamin D, and it comes with all the trappings of that. And it does 3 basic things, all under the umbrella of transporting something from point A to point B in your body. What that means is, in practice, it helps to transport lipids, and this is sort of its main job, right? This is what the requirement is actually set on. So transporting specific lipids like DHA, for example, spoiler alert, we'll see in a minute, to help support various functions like development. As a component of acetylcholine, it helps to transport messages in the brain to help support various functions like mood, memory, and attention. And it also helps as a source of methyl groups to support epigenetic control of genetic expression and cellular function overall. So as I'd mentioned, choline forms part of the backbone of a molecule called phosphatidylcholine, as the name might give you a clue for. And phosphatidylcholine has a couple jobs, one of which is to help transport lipids, as we mentioned before. And one of those important lipids is that of DHA, which of course I think all of us in this room know is incredibly important, particularly during prenatal development, right? So phosphatidylcholine binds to that DHA, which then enters the VLDL and then travels around the body to do whatever it needs to do, right? All the various functions that it's so important for. So the idea is, if we had more choline available to help carry that DHA, would it in fact increase DHA status? So there's a randomized controlled trial. This was done out of Cornell University in upstate New York, where they took pregnant women and they randomized them to either receive DHA with or without supplemental choline, right? And they did this throughout from their second trimester on up until baby arrived, and they periodically took samples of blood from mom to determine markers of DHA status. And what did they find at the end? You see, there was actually a 67% improvement in DHA status overall just by adding supplemental choline. Remember that both groups got identical amounts of DHA during the course of this study. So a significant benefit for that, which is great. So of course, we're all super concerned about nutrient status, but the question that we often get is there some functional benefit that I can actually measure in terms of brain health or what have you that I may impart on my child? To that, I would show you yet another study. Now, there is something of a precursor to this, which I'm not going to go through in the interest of time. However, this study took a group of women and they randomized them to receive either one of 2 different diets. One was about-ish, the AI for choline, and the other was about-ish, 2x the AI for choline, and this came in the form of both diet and supplemental sources. And they followed up with, so these women took this throughout the 3rd trimester of pregnancy, and then all supplementation stopped when baby came, right? They followed up with these women 7 years later, or these women and children, 7 years later, to do some cognitive testing on them. And specifically, they did what's called sustained attention task testing, which means your ability to pay attention to a given event over time, right? So what does that feel like in practice? That's like sitting through 8 hours of scientific content and then not having your mind wander at any point. Not that that's happened here, right? Of course, because it's CRN, but maybe at other meetings that might have happened to you, right? So what did they find? Lo and behold, the kids born to the high choline consuming moms had significantly greater improvements or greater performance on a sustained attention task test, right? Again, 7 years later. But I think the important thing is actually the graph on the right, which is showing their performance over time throughout the test. And you can see that the kids in the colorblind, we'll call that dark blue line, their performance stayed flat and even throughout the duration of the test, but the kids born to the lower choline consuming moms, their performance declined over time. They weren't able to sustain their attention. So again, an intervention in somebody else 7 years ago. Pretty wild. And so last but not least, I will say this is something that is, the importance of choline is something that is recognized by public health authorities. Dietary guidelines here show or states that many prenatal supplements do not contain choline or only contain small amounts inadequate to meet recommendations. I just wish I could stand in a room full of people who could make that change. Just kidding. All right, last and but not least, we have our newest product just launched in May of 2024 under the leadership of our incredible business development manager for it, Optifolin Plus. So of course, we all know about the importance of folic acid and folate generally during pregnancy and the prevention of neural tube defects. But an often underappreciated aspect of that role is its role in biological methylation, right? And so methylation is the core function of epigenetic control over cellular function. And as we go through these millions and millions and millions of cellular divisions during the course of development, having proper control over that is incredibly important. And those methyl groups that are delivered by nutrients like folate and like choline are incredibly important mechanisms to control that specific function. So when we talk about folate, it's kind of a big world, but there's 3 basic flavors of it. Number 1 is what we call food folate, and that, as the name would imply, is the folate generally found in food like green leafy vegetables. That's a folic acid, which is commonly found in dietary supplements and specific fortified foods. And then you have L5-MTHF, which is the active form. And this is what is actually doing the work in your body to transfer those methyl groups. And you can see that, again, like every nutrient, folate is also helping to carry something from point A to point B, specifically that methyl group. And the presence of that methyl group is something that folic acid does not have. It has to go through a series of steps in order to be converted into 5-MTHF. And so that's why there's a lot of interest in directly providing L5-MTHF in dietary supplement form, specifically to transport those methyl groups. So the exciting thing about our Optifolin product is that it actually contains, it's a combination of both folate and choline together, which delivers 7 methyl groups overall compared to the 1 of traditional forms. That gives us 7 times methyl agent advantage. And that means 98% of that product is specifically designed to deliver methyl groups to both mom and baby. So there's a couple different advantages of that. Again, Optifolin Plus is the only active folate with 98% methyl capacity and a 7 times advantage. It's the biologically active form of folate, and it's not associated with things like unmetabolized folic acid, for example. But there's also some technical benefits to that as well, like enhanced solubility, stability, and shelf life preparation as well. And we'll go into that a little bit. Because if you've had any experience with L5-MTHF products, you know that they are challenging to work with or can be challenging to work with. Data that was released by ODS at Nutrition 2024 showed that about 40% of available products on the market actually failed dissolution testing, specifically for 5-MTHF. And some of them had to compensate to that by using incredibly high overages, sometimes over 100%. And that can be challenging. Not only from a formulation point of view, but also from a cost point of view. It's not cheap, unless Lauren gives you a coupon, which she will. Terrible joke, I know. But part of the advantage of Optifolin Plus is it does have industry-leading stability and solubility. You can see that compared to some of the other competitive products in the market. The stability of the product is incredibly good, so far up to 6 months and still ongoing. So we're super excited about that technical advantage of it as well. So with that, I'll turn it back over to Ms. Lauren to show you how you can put these ideas in practice.
Sure. So the purpose of today, too, is really an inspiration for innovation, right? When we talk about prenatal, what does all of that mean in practice? We talked about Ferrochel, VitaCholine, and Optifolin Plus. How does that come together for Balchem, but really as an inspiration for innovation? And how can we talk about what that means for our customers? Hemoglobin harmony is our first concept here. We wanted to give an idea for how you don't have to choose on effectiveness and comfort. As we look at Ferrochel, Eric explained about bioavailability, but not that GI upset that you might get from other forms. So this is a powerful blend and how you can experience the perfect harmony to elevate hemoglobin with a gentle touch. So this is an example of those structure function claims. We talked about that again in our session this morning and how important it is on what this might look like on a label. So with the right levels of using Ferrochel ferrous bisglycinate, along with Optifolin plus, the right form of L5-MTHF, here's what a label might look like. So here's just a nice little example for a prenatal booster from a supplement facts panel and from what the front of pack might look like for a dietary supplement. So a nice rounded overview of an innovation example. We talked about driving that premium those premium sales as a sidecar example. The next sort of innovation we wanted to give you to highlight VitaCholine, Eric spoke kindly about the DHA absorption and that 67% from the studies that we have from the clinical research. So again, when we talk about science-backed and delivering on what the consumer is looking for, what can it do for me? How can I get that extra as I'm standing in front of the shelf? What is it that I'm looking for? Well, unlock your baby's potential with Mommy Vita Prenatal Plus. This is a nice booster for helping you set the stage for your baby to have a lifetime of intellectual growth and development. Who wouldn't want that, right? Choose Mama Vita Prenatal Plus to provide the essential nutrition your baby needs for a brighter, more promising future. So here's another example, empowering moms, nurturing babies. Again, our vision is to make the world a healthier place. So we want to do that with you. And lastly, methylpure prenatal. We just went over Optifolin plus, and we talked a lot about the 7 times advantage of methylation and the extra methyl groups. As methylation happens 1 billion times per second in your body, how does that translate to the consumer, and what can we do with innovation? What does that look like on the bottle? Well, here's an example for you. You're not just supporting a healthy pregnancy. When it comes to that critical time of life, you're making sure your baby gets enough of what it needs, critical methyl groups to nurture your baby's genetic potential. Plus, with the higher levels of key nutrients to support healthy methylation, you're contributing to cell function and development. Give your baby the advantage of a strong start by choosing methylpure prenatal. So you can see with these higher levels that you wouldn't be able to get in another product. So here's an example of how you could use this in a multivitamin. 600 micrograms DFE, those higher levels to reach those RDAs for that pregnancy levels that we need, above the 400 for adult, and the 110 milligrams of choline, of VitaCholine that you might not be able to fit in other types of tablets. With additions like B2, B6, and B12, we can support epigenetic health. So here's another example of a nice mock-up for the label with the inclusion of the kitchen sink of multivitamins, but a nice label, I should say, with the structure function claims, pure methylation and pure potential. So with that being said, unlocking prenatal innovation, what does that mean for us today at Balchem? Succeeding in the prenatal category means that you might have to offer prenatal premium products, but the health benefits can be there using Ferrochel, Optifolin, and VitaCholine. Greater bioavailability without that GI upset of Ferrochel. Optifolin plus to support the spinal cord development with the 7 times methyl agent advantage over other salts in the industry, and leading solubility and stability for our manufacturing. And VitaCholine, of course, to support brain and spinal cord development with 67% increase DHA absorption, delivering lasting improvements in babies' cognitive function that we can get with those higher levels in milligram dosage rates. And then, of course, at the bottom of the screen there, you see solving for those deficiencies where women just don't get enough. So it's really important for us to solve for innovation in different ways. It doesn't have to be so complicated. We're certainly here to help solve with our ingredients that are clinically researched, science-backed, and can support your next innovation. Certainly, we're here to help. So with that being said, thank you for listening.
Thank you.